So just some important factors in terms of intervention design. Again, these are kind of issues that have come up in the research, as important around nature-based and forest-based forest therapy interventions. Again, the quality assurance, so because there's a lot of people offering a lot of different things, the medical profession, the health professionals are very confused. What are people's training level? What is their skill set? What do they do? Do they just bring people on a walk? So in terms of building up the awareness around the power of forest therapy interventions, it's very important to understand the aspect of quality assurance. And again, there's international debate, in relation to setting standards for the area. I mean, there's a call for having maybe European accreditation standards, but again, that could take many years. Also, professionalism, as I said earlier, bad practice can undermine the credibility and the work for the rest of the nature-based providers. So it's very important that we can communicate exactly what we do, we can communicate the evidence base, and that we're very professional, in our dealings with groups and with referrers. Credibility, again, there's a lot of work being done in terms of building up the evidence base, building up best practice case studies internationally, to highlight best practice, and to try and learn from best practice. Evidence informed and theoretical underpinnings. So again, because we're talking about, working within the health system, providing interventions that fit, into the health service, we really have to focus on what is the evidence, what is the theory that underpins our practice. And then obviously ethical practice is very, very important. So, that we're aware of environmental ethics. So maybe, the work around the rights of nature, but also, we're ethical practitioners, that we don't, do any harm, to the people we work with or the environments that we work in. And, we participate in reflective practice, which we constantly question, our own practice and what is good practice. And we engage in continuous professional development to enhance our practice as well.